Time now to ask the expert. For the first time ever, a new report from the American Cancer Society estimates there will be a record number of new cancer cases this year. And by record, we mean it is expected to top 2 million cases. It's based on new research that points to shifting age patterns among cancer patients and a troubling increase in people who are less than 50 years old. So let's talk about it. Joining me now is Dr. Natasha Bhuyan, National Medical Director of One Medical. Okay, this is so alarming.
Yes.
Why is this? I mean, record cases
Right.
and people younger than 50?
Yes, we're seeing an increase in cancer. We're seeing an increase in cancer younger than people age 50. So doctors are actually not exactly sure why we are seeing that increase, but we do have a few theories on what's going on.
Okay.
So one is that we have a change in our gut microbiome. This is caused by things like people taking antibiotics, eating more ultra-processed foods. The other thing we're seeing is that people who have a diet that's high in red meat and high in salt, but low in fruits and vegetables and fiber, that can increase your risk of cancer as well. You know, we're also seeing things like physical inactivity, alcohol consumption. I think one new area is sleep. There's emerging evidence that if people get poor quality sleep, so if they're sleeping less than 6 to 7 hours, or they have abnormal sleep patterns, waking up in the middle of the night, going to bed at different times, that also increases their risk of cancer. And so we're seeing all kinds of trends. You know, the good news is, though, deaths from cancer are actually decreasing. And a few reasons why is because we know that people are, smoking less, we have targeted treatments and immunotherapies, and we're catching cancer earlier. But really, the bottom line is we are seeing that increased risk in cancer, and there are some people who are healthy. They don't have any risk factors at all.
Yeah, or no family history.
No family history, they live a healthy lifestyle, and that is the group of people that has doctors puzzled and we're doing more research on.
No kidding. Okay, so what can people do to reduce this risk?
Yeah, so if you're looking to reduce your risk of cancer and you don't know where to start, the #1 place I tell people to start is schedule a wellness visit with your PCP, with your primary care doctor. There's a couple of things we can do. So certainly we can order screening tests for you, but with your PCP, we can review your individual health history, determine your risk factors, determine the right tests for you, look at things like race and ethnicity, and then also vaccines. You know, things like HPV vaccine, Hep B vaccine, those decrease risk of cancers as well. And then from there, I do encourage healthy eating. So if you look at your plate, 2/3 of your plate should be fruits, vegetables, whole grains, and beans. Having that healthy, diverse diet really makes a difference. Activity, physical activity also makes a difference in reducing your risk of cancer. Now, it doesn't have to be running for an hour a day. That feels unattainable. There's really great research that shows even short bursts of vigorous physical activity can reduce your risk. So 4.5 minutes a day of running, doing jumping jacks, doing crunches, 4.5 minutes of vigorous activity can actually reduce your risk of cancer.
That sounds like nothing.
Yeah,
that's less than 5 minutes.
Exactly, and so that's emerging evidence. And of course, we want people to practice good sleep hygiene, avoid sugary foods, things like wearing sunscreen, making sure you quit smoking. I think all of these together can help reduce the risk of cancer. And of course, reach out to your PCP because we can really tailor a healthcare plan for you.
Okay, let's go over when people should get screened for various types of cancer, because I feel like some of them have changed over the years.
They have. This is a moving target, and this is why it's good to be vigilant of the ages, because the ages keep changing. So, before we used to say colon cancer screening at age 50, that's been lowered to age 45 because we are seeing this emergence in colon cancer. But that might be lower for people that have a family history, or if you have a different ethnicity, people who are Black are at higher risk as well. Breast cancer screening, that just changed a few months ago. It used to be age 40, then it was age 50, now it's age 40 again, so be vigilant of that. Cervical cancer screening is age 21. Lung cancer for people who have a history of smoking, that's at age 50. Prostate cancer is also variable. Some guidelines say age 55, but again, for people who have higher risk.
I've heard 50.
Yeah, so some people who are at higher risk, it might be 50. With a family history, it might be lower. And so this is why, it's not one size fits all when it comes to cancer detection and screening. It's really a matter of talking to your PCP. And the other big thing I tell people is if you have any symptoms that are out of the ordinary, fatigue, bloating, weight loss, it's so easy to blow off those symptoms, but don't ignore them. Reach out to your PCP because there could be something more serious going on.
Excellent, excellent advice.